Good evening, friends. Welcome to iTalk. And you know the iTalk, the program we talk about eye diseases, eye patients, and with the ophthalmologists also. So in this program, the 30 episode of iTalk, it's a very special episode for us. In this episode of iTalk, we have two special guests with us from India and Singapore. We have Dr. Diva Misra from India. He is the consultant retina specialist of IQ Super Specialty Eye Hospital in Lucknow, and also he is the General Secretary of Young Ophthalmology Society of India, that is YOSI. And we have our guest, Dr. Wong Chee. He is the Assistant Professor of Singapore National Eye Center, and also he is the Chair of Singapore Society of Ophthalmology YO chapter. The motive of this today's program, we will share about this situation, this pandemic situation. This is the new normal situation for us. We are really not expected this situation. We have to cope this situation. So we will share and we will hear from our guest how they are working in India and Singapore, how they serve their patients, and how they are working with their colleagues, and how the ophthalmologists are doing in India and Singapore. So, Dr. Diva and Dr. Ong, welcome to iTalk. And it's our great
Right.
pleasure that you accept the invitation.
Thank you so much.
Thank you for inviting us.
Thank you. Thank you. So, we are going to Dr. Diva first. So, Dr. Diva, you are from India. And would you like to explain the current situation, COVID situation in India?
Right. First of all, thank you, Dr. Huck, for inviting me to this wonderful platform. And I've been told that a lot of young ophthalmologists and ophthalmologists in general will be joining us today. So a warm welcome to all the Bangladeshi young ophthalmologists and senior ophthalmologists, of course. So all of us have been really hit hard by this global pandemic. And ophthalmologists are at the forefront, dealing it at the front. And this situation in India is pretty bad right now, and it keeps on worsening every day. And we are almost close to 1 million cases with 26. The last I checked, there were 26,000 deaths so far. So the situation is quite grim. But being a retina surgeon in India, I had not stopped my practice. I was off from my practice for probably 20 days in April, but I had to get back because of a lot of emergency cases, retinal detachments and stuff coming in. But I always believe April was far safer than what it is now, and we always need to keep taking the precautions and working on them, and things will get murkier as we go across. Yeah.
Thank you. Thank you. Now, hear from Dr. Ong about the situation in Singapore.
Hi. Good evening, everyone. And thank you once again for inviting me to this wonderful program. I think it's fantastic that you guys have this iTalk program, and it's 30 episodes already. That's like an entire season. So congratulations. I think it's a fantastic job. So in Singapore, I think we started to institute measures since February this year. So since February, basically, healthcare workers were the first to be affected. So essentially what happened was we are the first ones to take extra precautions. We are not allowed to go to other hospitals. So some of us who practice in different hospitals, two or more hospitals, we have been in fact segregated to a specific hospital for the past 6 months. So it started off with very few cases in Singapore, and we thought at that time that we were doing very well because very few cases and no deaths. I'm not sure if we got kind of complacent a little bit, but what we saw was a second wave that came in because of basically imported cases. So a lot of, I think rightfully so, we asked a lot of our citizens to return from wherever they were studying or working overseas to come back to Singapore because the global situation was actually getting worse with WHO announcing that COVID is now a pandemic. We actually asked a lot of our citizens to come back home, and basically because of that, the number of cases increased. Some of them were imported, some of them were already in the community. Then after that, we had to institute what we call a circuit breaker. So this is, in other countries, you call it a lockdown, but in Singapore, it's not as drastic as a lockdown. So we called it a circuit breaker. Essentially, what we did during this time was that everyone, or most people except for essential workers, had to work from home. Schools were closed, and we remained closed for 2 months. So all eating places, restaurants, entertainment venues, they're all closed down for 2 months. But supermarkets and essential services remained open. In hospitals, the same thing happened. We asked a lot of patients not to come to the hospitals. We stopped all elective surgeries, and then we kind of worked in a team-based manner for that 2 months. So about 3 weeks ago, we came out from our circuit breaker, and the number of cases were monitored very, very carefully. And you might have heard about our election. We had an election last week, and people are really worried that that would cause the community cases to go up. But somehow we managed to keep it under control, and now our community cases is actually declining. So what we are doing now is we are slowly opening up more facilities. So that includes entertainment venues like restaurants as well as cinemas. So I think the balance between saving lives as well as saving livelihoods has to be there. We could be a mini lockdown for much longer, but that would mean people's livelihoods could be destroyed. So I think this is a good balance, and we've come out quite lucky from the whole episode.
Yeah, that's good to hear that you're slowly opening up in Singapore. That's the very good news.
Yeah.
The one thing in Bangladesh, what we see that the effect of COVID in the doctor community is very high. So most of the doctors are affected by COVID. So what is the situation in Singapore and India, that how many doctors are, what is the percentage of affection of doctor by COVID? Dr. Diva.
Yeah. So the percentage, we don't have the official statistics on that, but doctors have been affected, and in most of the major institutes and the major hospitals which are handling the majority of the patient load, the infection rate is tremendous. So a lot of them have been affected, and all of them have to undergo a quarantine, and then there have been deaths also. So we all are very saddened by that, and it affects everybody mentally as well, because despite taking all the precautions and set by the government and the institute, still people are being infected by the virus. So I don't have the official statistics, but yes, it's the number is good, huge.
Yeah. So what's the situation in Singapore?
So in Singapore, I guess right from the start, the message to healthcare workers was very clear, and that was, we had to be very careful because there's a high risk that we could spread it to our patients. So right from the start, we had to take very careful measures to make sure we don't contract the disease ourselves, or if we do, then don't spread it to others. So I think in Singapore, the rate of doctors specifically getting infected is actually quite low. I know of a few, actually very few in ophthalmology who were infected, and as a result of being infected, the department worked really quickly to basically quarantine everyone that had close contact with the COVID positive doctors. And so the basically transmission was very quickly stopped in among healthcare workers, especially among doctors. And for us, I think wherever we had any acute respiratory infection, any symptom of acute respiratory infection, we basically had to take a 5 days medical leave, and we'll be swabbed. Okay, and actually I also recently had a swab done myself, which turned out to be negative. But this the level of precaution is actually quite high. Yeah.
Coming to the ophthalmologist, I think ophthalmologists are not that affected in India as of now. But last week in the city I was studying before, So one of a very senior ophthalmologist, a professor in ophthalmology, died due to COVID. So he was in COVID duty and he expired because of that. But apart from that, I think though there have been infections, but hopefully not too many deaths in ophthalmologists. But yeah, in otherwise other specialties, anesthetists, intensivists, those people are really affected bad.
So the other thing that was quite interesting is that there was a lot of attention on whether COVID could spread through the eyes, through the tears, for example. And in fact, in Singapore, we find that most of the healthcare workers who were not infected at work. So at the workplace, because of all the stringent measures, putting on face masks, PPE, and so on, basically what they had were infections from the community, from their social activities rather than from their work activities.
Yes, that's very true actually, because yes. I didn't have that experience, but my wife, she's a plastic surgeon. She works in a general hospital. So recently there were a lot of cases amongst the healthcare staff in her hospital, but surprisingly, we also found out that most of them had acquired infection outside the hospital. Somebody's parents, somebody's room partners, or something like that, but not directly from the hospital. So that is one finding that we have seen. Probably in the hospitals where they are taking the proper precautions and everything, and the staff and the doctors are being educated well about all these things, and they are strict about these precautions, then they are being able to avoid the infection.
Yeah,
that's
the thing. Actually, that's the thing in everywhere, I think. So, though we are starting the routine surgeries right now, and in Bangladesh also, we have stopped the elective surgeries till month of May. But from last month, we have started all kinds of cataract, LASIK, and other surgeries. Though only the retinal emergency surgeries we continued in that lockdown also, but now we are starting. So I want to know about what are the precautions you are taking in your hospital before doing the surgeries for the doctors, for the patient, and for the staff. Dr. Diva, please, and then we will come to Dr. Wong.
Right. So now most of our energy and most of our minds are always in that direction. So to stop the infection from coming inside the hospital. So that was working really good before, but now since so many cases are coming in India, I believe it will be really tough to avoid cases. So what we have done is probably in most of I'm not in a government hospital, I'm working in a corporate hospital that we call in India. It's like a private chain of hospitals that has around 40 branches all across India. So what we have taken very stringent measures from the starting. The whole entry of the patients is blocked, and we get the documentation about their exposure and any symptoms they have. Then the hospital staff checks their mask and sanitizes them. And now what we have gone paperless. So all the bills and the receipts, everything is directly sent to their mobile phones and email addresses rather than handing out them physical papers. And then, of course, a lot of emphasis is on the round-the-clock cleaning all the surfaces, and every hour the floor cleaning, and all those precautions are being taken. And of course, surgical, we have. Do you want to know about the retinal surgery precautions that we are taking, or you want to come that in the next question?
We
can talk about the retinal surgery, and then we can talk with Wong about the anterior segment surgeries. So no problem. So, we can continue.
Right. So there were a lot of precautions that we had taken initially, and like simple things like putting a face shield in front of a indirect ophthalmoscope. Then we started discarding our indenters. We started using cotton-tipped applicators, which could be discarded after use. And in our centers where we had the OCT angiography systems, then we stopped doing angiography. For most of the period, we had stopped the angiography procedures, but now we have started doing them with all possible precautions and taking all the investigations before that. And then cleaning the equipments that I used, often like a 20D or a 90D, we keep cleaning them with soap, water, and sodium hypochlorite. And we are not doing the contact method of laser. I'm doing most of my lasers through the IDEO, trying to delay the focal lasers and all those things. And apart from this, most of the GA cases we tried to avoid in the beginning, but now we are taking them with all proper precautions. Coming to the surgical part, we are mostly using the walled cannulas and preferring vitrectomy over buckling procedures and other extensive procedures that we are doing earlier. So minor changes, but I personally tried using the PPE kit while operating, but it was really uncomfortable and it became really hard to do the surgery. So I would also like to hear from Shiva and you how you are, in the OT, what for the doctor's safety, what precautions are you guys taking? Because it's
One
really
thing,
tough.
yeah. And one thing I want to ask that with the face shield, are you comfortable? Are
No,
you
not
guys comfortable?
See, I'm not even comfortable with the N95 mask right now because I did some online search on it also. So what I started getting some lightheadedness, some vertigo, and a lot of headaches. So I searched it up on the internet. There was a lot of data on that. A lot of people are facing that problem. It's going to be really tough if it gets delayed with all the face shields. You cannot operate with the face shield. You cannot do a slit lamp examination with the face shield. The goggles also, their width is so much that it's difficult to use them on the microscope and slit lamps. So for our specialty, I think we need to come up with some innovations and, so that we can prepare these face shields and masks which are comfortable to us. Because other specialties like general surgery or other surgery, it's easier to use these things. But in microscopic surgery, it's really difficult to.
Yeah, it's very difficult. And it's very uncomfortable. What you told about the face shield and N95 mask, it's really difficult. And because after wearing the N95 mask and wearing it for 6 hours, I feel breathlessness. So, and I feel dizzy in the evening also. So what's about Dr. Wong? So how you do the precaution in your hospitals, and what's about you?
Yeah, I agree with Diva, Kant. The face shield and especially the goggles is almost impossible to look through a microscope with goggles on. I tried it myself. I wore full PPE with N95 and as well as goggles to do a intravitreal tap and jab for patient endophthalmitis. And after that, I had a splitting headache. So there was even a study. Someone did a study in Singapore to show that if you wear N95 for more than 4 hours, you will have a headache. So essentially, which tells us that you got to take it off at certain intervals to take a break. Otherwise, you're gonna have a tough time. Yeah. So in Singapore, I guess quite similar to what Diva Kant has already outlined. The precautions are similar. We will always screen patients for symptoms, contact history before they can even come into the day surgery ward. And of course, if there are any of those symptoms, they'll be sent straight to the emergency department to do a proper examination as well as possibly a swab as well. So only patients who, so far we've been lucky. I've not had to operate on the patients with COVID before, but for GA cases, for sure we will have to be in full PPE. In fact, during surgery. As for cataract surgery, so essentially in terms of anterior segment surgery, we have cut down a lot. So we can't do transplants now. That's actually a national initiative not to do transplants during this period. And other forms of anterior segment surgery, initially even cataracts we couldn't do unless there were emergent procedures like if it's phacomorphic, for example. But now we are starting to do more cataracts. We do not actually take any extra precautions. For example, for my surgeries, I don't wear an N95. I wear my glasses. I don't wear a face shield or goggles because essentially it's almost impossible to do a proper surgery wearing those things. So I know some hospitals, they do put a shield over the patient's head to just in case there are aerosols that generate from the cataract, the phacoemulsification procedure. And I've actually looked at the literature. There are some people that say there's no aerosolization from cataract surgery, and some that have shown really nice videos of how much aerosols can be generated
Yes.
from cataract surgery. And
Yes.
I guess if you look at it this way, when we do cataract surgery, essentially we replace most of the aqueous with viscoelastic before the phaco probe goes in. So whatever is generated, most from the phacoemulsification procedure, most of it will be BSS. Okay, but of course, we can't be sure. So if you have a COVID positive patient, then you should be in N95. You should probably wear goggles, and you might even want to have a face shield over the patient as well. And I guess the others, as Diva has mentioned, COVID has kind of pushed us towards more digital transformation, pushing everything to paperless. So what we have done is also that we have eliminated our handwritten post-op notes in lieu of digital post-op notes. And everything is digital. Medications are delivered to the patient's homes instead of them having to queue up to wait for their medications. So all these are in the spirit of social distancing to minimize queues forming up in the hospitals especially.
Okay, but when the patient enter to OR, do they wear mask in all their, and do they wear mask when the patient wear in the
Yes.
OR, enter the OR, and do you cover the up part of the mask with the micropore or strip?
No. So all patients, regardless of whether they are here for surgery or not, even if they are here for just a clinic visit, in fact, every Singaporean who is on the streets will be in a face mask, essentially. So everyone has a face mask. But we don't particularly put any micropore tape over the to seal off the face mask. Not sure
Okay,
whether in India you do that.
No,
yeah,
we are
that's
doing
good, but we also do it.
Yeah, but face masks are compulsory inside the OR, of course, and we have not done the taping of the mask as yet. But I've been contemplating doing that for at least my laser procedures. And Wong, Chee, do you do lasers now? You're doing any special precaution that you're taking? Because I'm more concerned about the lasers, because we get a bit complacent when we are doing lasers, and there's a lot of contact when. So I recently shifted my patients to the OR for doing the lasers and taking all similar precautions. So for all
the lasers we are doing quite a fair bit, and we have the face shields that the shields that you use at the slit lens. We also have it at the laser machines, but we don't have any.
Are you using the indirect ILO, or you are which technique are you using for your lasers?
You're using the Pascal machines mostly. Yeah.
Okay. That's probably safer, do you think?
I'm not particularly worried, but maybe I'm a bit complacent. So I don't think any of my colleagues have taken any special precautions, but for intravitreal injections, we have been told to wear goggles, essentially. Yeah, but for lasers, so far I have not taken any special precaution other than the face shield at the Pascal machine. The other thing about wearing face masks that I find, right, is that it fogs up your lenses when you do the slit lamp examination. So how do you deal with that?
Yeah. So those industrial, I'm not using face mask when I do the slit lamp examination, because of course it's not possible.
Okay.
Right. So I've been using those goggles, the goggles which really fit close to your eyes, and they are tight fitting so that the fogging does not happen with them. So that I've been using, but I feel I've been using the shield on the slit lamp. So I feel that takes care of most of the aerosols or anything that might be coming to us.
Yeah.
But the problem is someone like me who wear the glasses, it's very difficult for them to wear the goggles. That is the main problem. So we sometimes depends on the face shield. So that is the thing.
but it will be really difficult to do a slit lamp examination with a face shield.
Definitely.
Yes. Very
Definitely,
difficult.
definitely.
I
Very
think it's
difficult.
I think it's impossible.
Yeah, yeah.
Yeah.
So another thing I want to discuss about that in right now in Bangladesh, like we don't have the telemedicine system for the ophthalmology, but right now it's become very popular, and the separate companies are coming with the mobile apps for the video conference. But my
Right.
question is that for the eye patient, it's really very difficult to consult with the telemedicine or only the mobile video apps, because you cannot see the retinas, you cannot see the inflammation, you can only give the treatment of the conjunctivitis. So what's the situation there in your places?
Yes, so I've been using a lot of tele consultation of late. Our whole hospital has focused a lot on tele consultations because they feel as the virus progresses more, so this will probably be the mainstay of consultations. But of course, you've said very rightly that probably retinal examinations or anything, if you want to examine in detail, it won't be possible. It's only possible to take care of very superficial things like a dry eye or a sty or something like that. So these are the things I've been getting a lot of similar cases. But of course, for all my retina patients, I have to call them, and our specialty is a surgical branch, and you need to do a lot of tests. So it can never, replace physical consultations, but at least you can stay connected to your patients and take care of your post-op patients and such. So I think it's a useful tool, but it can never replace physical consultations. Yeah. And we have been using a lot of apps. Our hospital got us registered on most of the telemedicine apps that are available. So we've been getting a lot of consultations, and the problem that I started facing was that when we started practicing full time, so I was getting disturbed by the teleconsultations during my regular flow of patients. So but then I started dedicating time to all these apps. Have the option of selecting your slots. So then I
Yes.
started keeping dedicated slots for teleconsultation. So I'm getting a
Okay.
fair amount of numbers, and it's good, but only for superficial pathologies,
Yeah.
nothing.
Yeah. Definitely. Definitely. And what's about Singapore?
Yeah. So this is a very tricky problem for retinal specialists. I think I consulted Diva Kant as well in the early stages when we were considering exactly how to do a proper teleconsultation for retinal patients. And I agree with Diva Kant that it's almost impossible. So we have taken a different approach, which is basically, I mean, the primary aim is to kind of minimize patients' dwell time in the hospitals. So what we are planning to do or have already started doing is that we have what we call imaging clinics. So patients come in to do OCT and maybe a wide field fundus photograph, and then they go home. So it reduces a lot of the time that they spend in hospital waiting to be seen by the doctor, and essentially reduces their risk of contracting COVID in the process. So with the imaging results, we can then conduct probably a better teleconsultation with these patients. We are also looking into using some of those handphone apps that can monitor patients' vision better. So I think there are several apps that not only monitor visual acuity, but they also kind of like a very advanced Amsler chart that can monitor patients with neovascular AMD, for example. So all these things have been helping us to take care of patients during a time when they cannot come to the hospital to receive their routine care.
Okay, so now comes to the young ophthalmologist side, so that the ophthalmologists who are now in training or who are now in fellowship. So what's happening now that the SNEC is now taking the new fellows, or they reduce the numbers?
We are still taking in fellows. In fact, our fellows during the past few months have been the stalwarts. They have been holding the fort for us in terms of seeing our patients and taking care of the subspecialties in SNC. So they're actually done very well, despite the fact that they are kind of isolated from they can't go back home. There are no flights out of the country. So I think they've done a really good job. But we have not actually stopped recruiting or accepting new fellows. The requests are still coming in, and anyone who is interested can always contact us. Of course, I always said this is to plan early, decide what you want to do early, and then start planning, start writing into the hospitals you are interested in doing your fellowships at. And if possible, I would even suggest that you try to do an observership first to see if the hospital is a good fit, whether it actually will be able to meet your training needs. Because you don't want to spend a year at a place and find that you actually haven't learned much and you haven't learned what you wanted to learn. So that's something that's very important.
Yeah, definitely. And what's about, I want to ask Diva that in this COVID pandemic, are the fellows getting less chance for training? Sometimes the hospital getting less patients. So what's about the condition of the fellows?
Yes, I think the condition is quite miserable for them, to say the least. I think the retina fellows are getting a decent amount of exposure still, despite all the issues. But all the refractive surgeries, all the cornea procedures, and probably some oculoplasty procedures, all these things have gone really down. People are trying to delay the procedures, and patients are also not coming. The patient load has gone down. So what is being done right now is in India is that most of the fellowship programs have extended their fellowships for another 3 months or so, depending. Some residencies have also been extended. Most of the residencies were extended for a couple of 3 or 4 weeks. And training, these fellowships have been extended for up to 3 months to 6 months. And but I think as the situation keeps evolving, this will also change, but they have been impacted a lot, and we'll have to find ways how to, have them well trained later on. It's everything is on hold as of now, yeah. And they're
Okay,
not
that's
taking. Yeah.
yeah. And that's thank you. We're at the end of our program, but the thing is that we want to know a little bit about from Young Ophthalmology Society of India from Divakant, Dr. Divakant.
Sure. So a quick history of Young Ophthalmologist Society of India, or YOSI as we call it. So it started in 2014. Dr. Tarun, Dr. Digvijay, Dr. Vijay, all these key people, they were all from All India Institute of Medical Sciences, and it was their brainchild. They started it in 2014, and it started picking up pretty good. And our team came into being in 2018. So then we started focusing on all the aspects that our seniors had laid down for us. And now we are having a membership of almost, so probably a lot of people might not be knowing that YOSI is an autonomous society. So we have our own constitution, we have our own structure, and our own election process and everything. So, and we are affiliated to the All India Ophthalmic Society, and recently we got affiliated to the International Council of Ophthalmology as well. So both our these bodies have recognized us.
Great.
And, right now we have a membership of almost, as I said, around close to 4,000. And we are planning a lot of activities. And during this time, we discovered this new platform of Zoom and all the online webinars. So we tried to take up pertinent topics. And recently, we did a session with our All India Ophthalmic Society, where we asked all the seniors to guide the juniors. So we invited young ophthalmologists from all different segments to come live and ask queries from the senior ophthalmologists. So they got some real good answers and some concrete plans for the future post-COVID, how we can help them in terms of residency training. So I think YOSI will have a key role to play, more so with this scenario that has hit us now. And as things stabilizes, we'll definitely try to help the young ophthalmologists from India and international ones as well. Yeah.
That's great. That's great. But my question is that what's the criteria to become the member of this society, and up to which age you can be the member of this society?
So we have, our constitution has given us 3 criteria. So the first is that anybody under the age of 40 years is a young ophthalmologist, and anybody in training is in residency or in a long-term fellowship is considered a young ophthalmologist despite his or her age, because maybe he is more than 40 years of age, but still he is, as an ophthalmologist, he is young. And anybody who is has completed training in the past 5 years, so within that time also, that person will be considered a young ophthalmologist and can take our membership.
That's great. That's great. So we want to hear from Dr. Ong that what is about the EO chapter of Singapore Society of Ophthalmology.
Okay. So I think we derive a lot of inspiration from YOSI as well. It's really a great organization, and the work they've done is really spectacular. And the YO definition for us is similar. So it starts from year 1 of residency all the way through to the first 5 years of their specialist career. So it doesn't discriminate in terms of age, but rather tries to serve all ophthalmologists that are still in their early years of their career in terms of education, professional development, leadership, and also to help benefit the entire ecosystem, which includes our mentors who are no longer YOs, but they still want to contribute, and they really serve a very important role in the ecosystem as well. The other parts of the ecosystem will be the local community. We want to find ways for YOs to give back to the community, and also to try to connect to the regional as well as to our global professional networks such as YOSI, right? And I think Diva Kant has set up this group called the Asia Pacific YOs, which has been very, very beneficial, in fact, I think, during the COVID period, where we shared a lot of educational resources. We encouraged each other. We shared best practices, and I think it has been a very supportive group in totality. So I think we don't really have international members yet. I think YOSI does, right? But we have not actually thought about that. But it's a good idea. We should have international members, and our members should become members of other YO societies as well. So I think during this COVID period, it's been wonderful to see all these YO activities ramping up, and also some new societies in other countries have kind of grown, and some new ones have been set up as well. So it's a great time to see the community coming together to endure this COVID pandemic together.
Thank you, Dr. Ong. And in Bangladesh, we are also trying. Hopefully, we can follow you soon. So, with all your help, we can also form the YO chapter in Bangladesh. So, thank you very much. So, viewers, thank you for watching this program. Hopefully, for the ophthalmologist, how we practice in this COVID pandemic, and how our friends in Singapore and India are practicing in this COVID pandemic, we know from them, and we thank them to join our iTalk program, and hopefully you will be with us in future also. And thank you very much. Thank you, Dr. Diva Misra, and thank you, Dr. Ong Chee for joining us. Thank you very much.
Thank you.